Good morning, good and gentle people. This is week 4 of storytelling in Sickness and in Health. At the end of chapter 2 in the New Medicine, there is a discussion about the difference between healing as a physician versus relief of suffering. There is a distinction. One calls for the provider or the physician to do the best they can to heal, which in and of itself should relieve some suffering. Relief of suffering as an independent statement can easily slip to abortion and suicide euthanasia, which Hippocrates does not want to participate in. To quote from the book on page 66, "In the oath itself we see recognition of the danger posed by the relief of suffering ethic, subversive as it is to the very Hippocratic idea, short-circuiting the healing task of putting the patient's life under the threat from the doctor himself." This week's reading in Hippocrates' Shadow, we found many stories of how the medical community often does not agree on what should be done, yet insists that they are right, even to the detriment of the patient. The dichotomy between the science and the art of medicine is ever present. Sometimes "do not harm" is lost in the rush to do anything to fix, to make the grade. This story that follows is not my own, and it will illustrate both our philosophy and the magic bullet readings of the week. I begin. Paul Ehrlich coined the term magic bullet as a chemotherapy for the first applied to the disease of syphilis. It would seem that all could be deemed great and wonderful, a cure for a terrible and common sexually transmitted disease that could also affect the unborn children of infected mothers. This is a good thing, yes? Today, an estimated 10,000 Americans will contract the infection, which is on the rise, by the way, and worldwide the number approaches 37 million cases. While we do not use Ehrlich's arsenic anymore, syphilis is easily cured on an episodic basis by Fleming's finding of penicillin. This has saved countless lives and others serious disabilities. However, the study begins. In 1932, the Public Health Service, working with the Tuskegee Institute, began a study to record the natural history of syphilis in hopes of justifying treatment programs for blacks. This was called the Tuskegee Study of Untreated Syphilis in Negro Males. The study initially involved 600 black men, 399 with syphilis, and 201 who did not have the disease. The study was conducted without the benefit of patients' informed consent. The researchers told the men they were being treated for bad blood, a local term used to describe several ailments including syphilis, anemia, and fatigue. In truth, they did not receive the proper treatment needed to cure their illnesses. In exchange for taking part in the study, the men received free medical exams, free meals, and burial insurance. Although originally projected to last 6 months, the study actually went on for 40 years. Now, in the 1920s, a good intention was begun by noting that the poor health of black men was seen as an inhibiting economic development, and major health initiatives were started. Syphilis was seen as a major health problem since the prevalence of syphilis was 35% observed in the reproductive age population of black men. Aggressive treatment programs with mercury and bismuth were initiated, but the rate of cure was less than 30%. Treatment required months and the side effects were many, including sometimes fatal ones. Then, in 1932, the Tuskegee Study of Untreated Syphilis in Negro Males was started. Now, in and of itself, this was not bad. There was a need. There was no definitive cure until Fleming's work with penicillin in 1945. What was bad was the men were isolated and essentially experimented on without a proper understanding of the consequences. Worse, after the cure was known, penicillin, in 1945, the study did not end. It was not until 1972 that the study was closed by public outcry. The scientists and providers, often one and the same, the good and the bad, the well-intentioned and perhaps the corrupt as well, all participated in this piece of history. The history of the cure of syphilis is one of the great accomplishments that saved many lives, and the tragedy is on the use of men to prove the point. It is not the first nor the last exercise in using an isolated population to find a cure. Rabin did the same thing with polio in small rural Russian cities, and Ebola has been studied in isolated parts of Africa even today. This is a clear example of the need for thoughtful and educated people to use science for good, and making sure that the path to the good is not strewn with cruelty of mistaken altruistic motives. Hippocrates would have been very disappointed.